Um, Tonight is a meeting with the Health and Human Service Committee and Board. I would like to bring to the attention those in attendance tonight. Our county board supervisors, our Supervisor Miller, Spencer. I'm hoping Supervisor Coleman should be here shortly. Hopkins, Kelly, and myself, Trottier. Our board members this evening are Dunkulovich, Hood, Supervisor Meyer, Neighbor, Supervisor Shakur, Zuck, and myself, Supervisor Miller. Excuse me, Supervisor Trottier. What am I saying? Youth and Governance Representative, excused this evening's Colin Dindy, and we have President Telez this evening. Thank you all for attending, and we have a good attendance. I have, as normal, I have a chairman comments. I usually made them when I was chairman of the finance committee. So I'm just going to state this evening that the purpose of this meeting in general is required by state law to provide an early budget plan to identify how the state and federal government's legal requirements will cost our taxpayers. This will set a baseline for part of the county budget, which the county executive proposes in the fall and is finalized in November. So this is a map of what will be going forward. And again, this is required by the state. And we're all going to have big ears this evening and listen to the presentation. Next up on my list is number 3. Ignacio. Oh, before the public, oh, yes. Okay, thank you. Public hearing. Ignacio, could you read the youth and governance statement, please?
Sure. Hi, everyone. My name is Ignacio. I'm an incoming senior at Park High School, and I'm one of 2 youth and governance representatives on this committee. The youth and governance program allows and selects 10 youth across Racine County to participate and learn in local government and contribute meaningfully in those discussions. Thank you.
I have Hope Otto and her entire team here this evening to present the 2027 budget plan and strategic goals. Good evening, Hope.
Good evening, and thank you, Mr. Chairman and members of the committee and board. As Chairman Trottier mentioned, this is our annual public hearing, which is part of Wisconsin state statute, where we have an early preview into some of our budget planning. And it gives opportunity for both the board and citizens to be able to give input. As our budget is supposed to be designed with the needs of the community at the heart of what we're doing. And so what I will do today is give a comprehensive overview, but I'll also try to be mindful of time. But I wanted to have the slides prepared in a way that answered potentially on any outstanding questions or lack of clarity of what all the various divisions do, but not to belabor that point, but really then get to the end where we talk about our point in time budget, the projections, and a foreshadowing into the some of the asks that we may have for the county executive and the board to consider. So again, thank you for the opportunity to present the budget tonight. And I want to highlight some major trends that we're seeing in strategies that we have in producing some measurable results. At the end of this presentation, I will hand it over to Travis Richardson to walk through our impact and outcomes dashboard that was put together by the team, because it's helpful to not only, verbally express and through a PowerPoint, but also to see the data and the results of our work. And so we have a really great impact and outcome dashboard that we will go over afterwards. And every year, as we're going through the budget, our team asks one question to ourselves, which is how do we continue to provide the same level of outcomes that the community has come to expect from our department while managing our taxpayer dollars wisely, when knowing that the vast majority of our costs are unpredictable. And we can do the best that we can to manage those unpredictable costs. But I will talk a lot more about that as we go through the proposal. And it's not working for me. This isn't me doing it, is it? Yeah, so down, got it. Okay, so as we go through here, you're gonna see 3 consistent themes. One is that prevention reduces long-term costs, local services create better outcomes than expensive institutional care, and responsible budgeting protects taxpayers from unexpected financial shocks. So here, I just wanted to refresh the scope of the department, the various divisions. We are set up into 5 administrative areas, and in there, the chapters that are associated with how the divisions are governed. And all 5 divisions are sharing one mission, which is to build resilience. And the vision is thriving individuals and families. Mm, And I'm over clicking. Here we go. Sorry. Got to be smarter than the clicker. Our strategic goals that we developed in partnership with the county executives, countywide strategic goals are centered around building trust with the community and connection, working better together, working smarter together, and really making support easier to access. All of the things, if we're doing it correctly, we'll be able to achieve these 3 strategic goals. And I'm hoping that the proposals that we have in front of you are achieving those. And we often say that we are serving the community through every stage of individual's life, from early childhood or even prenatal, all the way through end of life and the medical examiner. So we're really touching individuals at every phase of the lifespan. So moving on to our child welfare work. We are not asking for anything additional in this space, and partly it's because we're continuing to see positive trends in the work that we're doing. As I mentioned earlier, that of the 3 themes that you're going to notice here, prevention and investing in prevention reduces long-term costs and expenses. And the child welfare work really is moving in the right direction. We have fewer children that are placed in out-of-home care, and families are being supported right here locally in the community, and we have better permanency outcomes. So here's some of the data to show, not just by, again, what we feel is happening, but it's the data is demonstrating that we are seeing a reduction, not only in reports, but shifting into more safety services and less removal, stabilization in placements, and that's proved by the reentry rate, which is declining over time, so that kids are staying in their homes and they're not reentering in the child welfare system. Another reason that you're seeing these trends is the population decline. We are seeing less live births, as we know. There's a general population decline in the United States, and Wisconsin's not immune to that. So we're seeing less youth entering into the system. The prevention work that we have more services early on is reducing the need for deeper end services, and we're doing a much better job of working collaboratively and working together. Again, part of those strategic goals. And at the same time, youth justice has become more complicated, and we're seeing more behavioral and interpersonal conflict. And the offenses are requiring significantly more staff time, coordination, and supervision. You can see here that overall weapons charges are down, but we are seeing an increase in battery, disorderly conduct, as I said, interpersonal conflict, and also terrorist threats and theft. And the youth that are placed in custody are often in weapons charges or in some of the more severe areas and have more complex needs. We are seeing an increase in the number of referrals as well as unique youth into the system. So the demand, again, remains high. We are serving more youth in the community than in institutional placements, but that drives a greater need for supervision in the community in our youth justice area. The ratio that we typically like to see in child welfare youth justice, because of the intensity of the work and the complexity of the cases, is usually around a 1:5 or 1:6 ratio. So we are recommending adding in a supervisor, and we have the youth aides and an increase in that projected for this year and next in order to cover for that position. So that same increase in complexity continues into youth as they enter in the correctional system, as I indicated. So we're seeing higher acuity, increased mental health needs, greater demand for supervision and training and mentorship, and more intensive coordination as the youth are reintegrating into the community. Now, I recognize that this ask is very large, and we're putting forth what we think is an ideal sense of where the youth center should be, understanding that this may be a phased-in approach and a cost-sharing arrangement with the state of Wisconsin. And we've had robust advocacy efforts with our local legislators, with Wisconsin Counties Association, and both county executive, myself, and the team at the JDYDCC have been working tirelessly to secure an operational allocation to address this. But I felt it was my responsibility to present what we have researched in terms of best practices around other facilities in the state, and particularly state-run facilities similar to ours, like Mendota Juvenile Treatment Center, and the Lincoln Hills and the Milwaukee Partners. And because we are serving youth with increased needs, increased staffing helps to support that and de-escalate, because when you have a human connection, there's less likely to have a use of force and hands-on approach. Most models, just to give a frame of reference, have about 2, sometimes even 3 times the staffing levels that we have. And just to show the breadth of contracts and scope of trying to secure additional out-of-county revenue for our department, we are serving 11 different counties, 18 different contracts, multiple youth. Our out-of-county population ranges from, on the low end, around 11. And today, I think we're sitting at around 18. 17, okay, went down one. And so that we're one over where our budgeted census is, but it's unpredictable. As I had mentioned earlier, sometimes, you can look at trends, but arrests and violence isn't always like something you could put on a schedule for when you can predict those things happening. And it's not that we're wishing for that in other areas either. But we have had great success thus far, and some of our most proud areas are in the areas of educational attainment and industry certifications. We have a wonderful partnership with our vendor Aramark, who does a Save, Surf, and Into Work program for us, and does credentialing, as well as our Gateway program for 3D printing. Is that right? Yeah. Okay. So we're getting 9 industry certifications in there, high school credits, as well as 2 youth graduated high school in the actual center. And so we're very, very proud and having some great successes thus far. And this talks about how we can best serve youth in the continuum. We have our local justice system that are familiar with the needs of our community. We have the youth center here instead of 4 hours away. We have the educational system here with RUSD, a partnership with them, as well as TEP transitioning back into the school district, and focusing on our programs like the Connectors and our COP partners and individuals in youth justice to help youth reintegrate into the community to stay out of incarcerated settings. And one of the positions that I added in the previous slide, or suggested, talks about the youth program coordinator will be focused on community reintegration and family success. So one of the unintended consequences of good legislation, which is the whole partnership with the state to be able to divide all of our human services programs into sections, like the Department of Children and Families, Department of Health Services, Department of Justice, Department of Corrections, Department of Workforce Development. All those things are really good for being able to go in a mile deep on topics, but it doesn't necessarily make it easier for the community to be able to access programs. And there's increased complexity when it comes to having all of those programs separate. So those programs can become very challenging to navigate. And one of the things that has been a priority for me since I have been the director is to find a way to integrate the services in a way that is more seamless for our residents seeking care. So earlier when I talked about the 3 goals of improving access to care, People that are coming here shouldn't have to know the differences between economic support, behavioral health, the Aging and Disability Resource Center. And people in crisis should be met where they are at, and they're in crisis and they want to be able to navigate their existing problems. So that was a call to action to my team. And in the past year, they developed Wellness Connect as the answer to that. And it was the brainchild of both Steve Bedwell and Yelena Jones. And I can't think of a better division to facilitate Wellness Connect than our behavioral health area. Because at the heart of everything we're doing is behavioral change and helping to support people through that change process. And behavioral health, I really feel, is no longer a standalone service. I think it's become the infrastructure of the Human Services Department. Just as roads are supporting commerce and traffic, behavioral health is supporting the functioning of emergency departments. We get plenty of calls from hospital systems that are depending on us to be able to help to support people in a crisis. Our jails, law enforcement partners, schools, our correctional facilities, housing systems, aging systems, workforce programs, behavioral health intersects in all of those areas. And the demand on our department has expanded far beyond traditional mental health treatment. People want to be able to access services for anxiety and depression and things that are situational, not just chronic mental illness. And we're collectively trying to design a way to be able to meet that community demand. So, and at the same time here, you can see we are doing everything we can to reduce expenses in the more costly placements and help with the least restrictive environment. I was trying to think of the word, least restrictive placement as possible, because you can see not only from a financial reason, but an over response to individuals. They deserve to be in the most home-like environment. And so that's what we're supporting here. And we're using this data to help track it to see our accountability in that space. And Racine County is also, I want to give a huge shout out to Chairman Trottier, as well as Assistant Corporation Counsel Sarah Kidd, who did a lot of research at looking at innovative ways to help reduce the expenses of our institutional placements. In Illinois, there is, there is a hospital provider from Lake Behavioral Health, which is closer than a lot of our systems, including probably closer than some Milwaukee locations and certainly Winnebago, that has a much more affordable cost per day. And Illinois law has where they are covering Chapter 51s completely without any cost to the county. Kenosha County was the first to be able to find this option. And because we were not a direct bordering county, we weren't able to do this until our Assistant Corporation Counsel, Sarah Kidd, found a provision that said a bordering county to a bordering county is eligible for the same thing. So we are in the process of securing a contract with them that in the worst case scenario, if we are in a voluntary placement, we're at $950 a day as opposed to the almost $2,200 plus a potential $400 a day one-on-one charge that comes from Winnebago at $950 or completely cost covered. We did an estimate by looking at a 3-year trend since Kenosha's been doing this, and it looks like we would be saving anywhere between $500,000 and $750,000 conservatively every year. So just huge, huge thank you to the team that did this. And thank you, Yelena, and to Chief Deputy Weiner, who's helping with the law enforcement contracts, because every single municipality has to sign off on this. So there'll be a little paperwork associated with it. We're also exploring regional transportation coordination because one of the frustrations that I'm sure Ms. Hood will be able to attest to from the law enforcement perspective is having to transport our customers during mental health crises. And we're trying to develop a regional partnership to ease the burden on everybody involved and make the right decisions for individuals in crisis. And make sure nobody's falling through the cracks. So that's been a directive from the county executive to explore what might be a cost-effective option that has not been built into this budget, but may be a future consideration. And this is just talking about our SAIL program and the cost to be able to provide care in our community-based setting. Everyone, I think, is familiar with the SAIL program. It's our crisis hostel or a short-term duration to de-escalate an individual and get reintegrated back into their home and community. We average around $411 per day for that expense versus, again, the Winnebago psychiatric care. And every year from this model, and this is what will be relocated now over at 1720, thank you, Taylor Avenue at the new behavioral health complex, a much better facility that's conducive for healing and stabilization compared to our Dominic location. But $5 million a year that we're avoiding through that program that many other counties are not administering. And this is just talking about our success and our numbers. Another trend that we're seeing that we want to put on notice is that we are an aging community. We are an aging state and an aging county. And we expect that our senior population will double by 2050. And it is not only impacting our Aging and Disability Resource Center, but a lot of the other supportive areas that go along with that. Adult protective services, areas that help with dementia, financial exploitation and abuse, our Medicaid population for long-term care waivers for those who want to stay in their home in lieu of nursing home care. All of those pressures are being felt by our system. While we're not asking for anything directly in this area, we want to just make sure that the board and the committee is on notice about what increases may be coming down the pike. And Yellen is working diligently at making sure that we have adequate staffing to be able to address those, but not prematurely add employees. So we are proposing to convert our ADRC staff to county employment. And this is one of those areas where it is investing. I would view it as investing into ourselves versus investing into a contracted provider. We pay 15% of an administrative fee to Goodwill to provide the services. And that 15% is roughly $270,000. And then the salary adjustment for being within the county would be roughly 70. So that's a savings of paying ourselves in administrative expenses of about $200,000. Understanding that adding in staff is always going to be a point of pause. But it's worth at least pointing out, in this model that we have of hybrid contract and county employees, I think we should always be just at least looking at when it makes sense, either financially or operationally. There hasn't been significant turnover in the ADRC. So I will say that it's not necessarily a retention standpoint, but it is probably from a fairness standpoint because there are county staff that are overseeing contracted employees. And this is an area that is going to continue to grow, as I had mentioned earlier, and they're looking at allocation methods to be able to increase support for the ADRCs. They just haven't agreed upon a method to get it to us yet. So here, as I mentioned, the Medicaid and long-term care support. So if an individual is in a hospital and needs to be transitioned to a skilled nursing facility, for example, which I know Rhonda would be well aware of, or if they're leaving the nursing home and wanting to be able to be served in their home at a nursing home level of care, and they do not have insurance for this, Medicaid is often a payer for a lot of individuals. And this demand is growing tremendously. Our hospital partners cannot do effective discharge planning unless if there is eligibility. And so they want to be able to have a very quick turnaround and response. I field a lot of questions and calls and concerns from our hospital partners regarding this. And so we're looking at somebody who can navigate the complexity of long-term care programs, being able to manage customer service and effectively reduce expenses that are shifted to really other patients that are insured when individuals sit for long periods of time that are private pay. So this is a long-term community savings if we are helping to support a rapid transition of individuals to the appropriate level of care. So this is something that I feel is a community demand that I've heard for the past few years in an area that we could benefit from growing. This has been mentioned pretty extensively with the add of our existing positions or the adding of our additional positions as a response to the big beautiful bill and HR1. And there needs to be an increased focus on quality control, and those positions were fully funded through the state. So I just wanted to remind everybody that as we're going forward with a budget of anything that we would in the past call decision package 0, that this is something that was already approved by the board last week, but I wanted to put that on the radar that this was something that was added into our budget. This is probably the third year that I've brought up the need for an assistant CVSO. There's a ton of data that is supporting the need for increased staffing for our Veterans Office. They are working tirelessly, and it's really about quality and response time and that much more outreach for our people who are eligible for benefits that aren't aware of it because they're serving the people in more of a immediate response fashion. So this is the need is growing, and the amount of people who are eligible for benefits aren't receiving them. So this is something I think we've needed for some time. And I just wanted to kind of ground us back into the prevention-based work. It's very important to remember that all of the things that we talked about of the costly placements and everything that's extremely expensive is also maintained by a really strong prevention backbone. And our public health department does an amazing job of helping to serve in both universal home visitation program as well as the more intensive home visitation. And you can see the wonderful statistics here that we should be extremely proud of getting families supported and connected early on. And there's just some statistics that the health department does to show the breadth and scope of their work. And lastly, with the merger of for public health, the merger of the medical examiner in their area, the fatality review team does a great job of being able to connect the outcomes, the adverse outcomes that may happen in overdoses, to helping with prevention and harm reduction efforts. The request that we have here is really just to change the model of the on-call medical examiners and move to those hours into a full-time deputy because that work, and I saw that there was a handout that somebody printed out about the decline in volunteerism. There's also on Meals on Wheels, we're seeing a drastic decline in people that are willing to be able to serve in on-call temporary positions. They'll say the same thing from a law enforcement perspective, having reserve deputies. People are just not interested in that level of part-time work anymore, and it's becoming a challenge for us to be able to maintain our response times, and we're having to get that many more on-call deputies in order to meet our service needs. So if we reduce the hours to fund this position, in essence, we would be addressing that challenge. And I think one of the elements that I often forget when I'm focusing on direct service work is how important the behind the scenes work is to be able to support the direct service. So, when we're adding staff to these areas or this request of having a service desk supervisor, an additional staff accountant, these are two things that I think are really necessary for ensuring an emerging technological world where you have 24/7 call centers, emergency call centers for child welfare and behavioral health. And when we have 6 different buildings, I didn't realize it was 6, that they're managing, and we currently have 2 staff. We definitely have a need to support our workers across those different locations. And in the staff accounting area, we know that if we do a better job with drawing down Medicaid revenue, we can pay for this position and then some to be able to support our WIMCR cost reporting and compliance and maximize billing. And this is a very critical thing that I have been operating without because we went down a staff accountant a couple years ago as part of our budget consideration. So we're putting that request back in. So I'm going to transition now to the last part, which is really the philosophy of our budgeting. And when I said earlier that the majority of our costs are unpredictable. They really are. The things that are predictable are payroll and our staff. You know, we can predict for the most part our vacancies, at least, you know, to a reasonable margin of error. We can predict our utilities to a decent degree and our facilities and operations. But what we can't always predict is our placement costs, especially if we don't have a built-in option here locally. So this just talks about, again, what I've said many times to the group, but reiterating it in a different way. We can't, if a youth is ordered to a correctional place, and even if we have the JDYDCC, we're paying that. You know, we don't really have complete control. I like to say we have influence, not control. So our budgeting, we try to meet the prepare for the needs of today when we can't predict tomorrow. And these are how quickly costs can escalate if you are not budgeting conservatively. You know, 2 unexpected cases in any of these areas could have $1 million swing for us. So having a healthy reserves is something that I've been focused on to be able to address potential swings in this. We've been very fortunate, but you don't know when that's going to change. And I want to make sure that both the county executive and board are never in a position where they are, like many other counties around the state, finding you know, ways to have to cut multiple areas of the departments in order to address a shortfall. Not saying it could never happen, but I'm trying to do everything I can to prevent it. So just another way of phrasing this, it's not extra money. We're not trying to hoard money. We are trying to have money in the case of an emergency and protect the taxpayers and the people we're serving by avoiding those emergency deficits and reducing future pressure on tax levy by being able to utilize reserves in years. And budgeting for us, and you'll see in the upcoming slides, $1 million is still relatively conservative budgeting for us. And if we don't use it, that goes right back into our reserves to be able to address in the upcoming years. So it's not just the matter of my word for it to say I believe prevention is the best strategy and community-based care and integrated services. The proof is really in our numbers. That you're seeing in every single one of these areas a decrease. And while inflation still exists and our employees are still going to have costs and our budget is not going to go down, we are staying relatively static despite all of these changes. And I believe very strongly in the philosophy that both the board and committee and the department has adopted over the past decade or more. And I'm really hammering this point. If you don't, this is essentially what could happen. Reduced county flexibility in other areas, levy instability, multi-year deficits, because the problems aren't necessarily corrected in the single year. The placements can last, you know, a year or longer, 2-3-year correctional placements. And we put other practices and policies in place to ensure that we're maximizing our revenue by doing ongoing staffing and placement process reviews, constantly looking at where we can shift into more prevention-based work, reviewing monthly expenditures, and maximizing revenue. So we talked a little bit about the billing and drawing down Medicaid reimbursement, but also advocating for adequate funding from the state for areas that have been severely underfunded by them for many, many years, in some cases 2-3 decades. And as you can see here, we essentially are proposing without those additions, the budget without all the decision packages is flat. It doesn't even adjust for inflation. And this year we are projecting approximately a $2 million surplus. So the decision packages would add on a potential 1.4 million. We're hoping that number, it's almost all solely in the YDCC ask that would be met by some state support and or any sort of increased revenue from other counties if they found a mechanism for that. The county executive and I have a call tomorrow with the governor's office, and this is one of probably 8 calls in the past 2 weeks we've done to try to do that. But the budget essentially, without the decision package, is coming in flat. And this is a summary of what we are asking for adjustments. They're not all adds, but they're tweaks as well, and the funding sources that are associated with them. Just looking ahead, we're going to continue to focus on investing in all of the community-based work, prevention and early intervention, responding to the increased demand in the aging population and increasing behavioral health needs, and making sure that we're doing so in a way that is the most responsible for our constituents and taxpayers. And before I take questions, if it's okay, I think I will turn it over to Travis to walk through the outcome and impact and outcome dashboard. And actually, I can't take questions anyway, can I? That's later. While he's pulling that up, I also want to thank Michaela Showalter because this is a partnership between Travis and Michaela, but Michaela spent countless hours of helping to redesign our dashboard. Before, I felt like it was a little bit more of like numbers in, numbers out. It didn't feel like it was really looking at the better off outcomes for our community. And I think we've done a really good job of tweaking that to hopefully be more impactful to the audience that's looking at it. And Steve as well. Thank you. I know you put a ton of time in the outline with that.
All right. Hi, everybody. Thank you for your patience during that very long walk it felt like over here. I'm Travis Richardson. I'm the data director for Racine County. And it's really an honor to put together the Impact and Resource Hub dashboard for the Human Services Department. I think this project started with a directive from our county executive to help better tell our story. Something we've heard a lot. I think stereotypically looking at county government or government services generally, we're really good at describing what we do, but we're not so good about telling our story in terms of who we're serving and how we're impacting their lives. So you might hear us use a lot of program jargon and acronyms. You may see information organized like an organizational chart, right? Broken down by department, program, service, and not necessarily focused on the resident or the impact of that service on the resident. So just an example of that would be how many people followed up 6 months after successfully completing Elevate. That might not mean anything to our residents or our policymakers, you all, but knowing how many dads are now paying back owed child support, that's a really impactful outcome to understand, right, and how it affects our families. So that's kind of the core philosophy of this dashboard is we're really looking to tell our story better. And one of the ways we're hoping to do that is to organize information in a simplified version and organized around 5 impact areas that I think the Human Services Department really exemplifies well. And those are represented here in this. I'm sorry, it might be a little hard to see. It's easier to see on a screen in front of you, but this navigation bar here, you can see what some of those areas are. So I'll walk through this dashboard quickly, not going through every single metric, but just to give you kind of a lay of the land. The top bar here, those are the key performance indicators. They really demonstrate the reach of Racine County Human Services. So just to kind of walk through some of these figures, monthly residents served, that is the most conservative estimate for what that metric looks like using an economic support count as a proxy for that. So we're looking to clean that up, have an annual unduplicated count over time as we continue to update this dashboard. But really what we're hoping to show is just how impactful and how far reaching the Human Services Department is. I just want to call out Wellness Connect. As this dashboard is currently tracking information through end of 2025, this is a new initiative. So there are more wellness connections than zero, but just wanted to be transparent that this is also an accountability tool as well, right? So as we move through 2026, those numbers will be updated. So this first section you're looking at is early intervention and prevention. I think this was a theme throughout Hope's presentation tonight, but what are the services we provide to residents that prevent long-term downstream negative consequences, very expensive costs, and how do we track that and tell that story? So that could be everything from, fentanyl testing strips, Narcan distributed, right, to prevent deadly overdoses, to nursing home or nurse home visits through Hello Baby and public health um, for all families with newborn kids. It could be the birth to, and I'm ironically now citing a lot of programs, but just to give some context for the some of the metrics here, could be how many families we're serving with kids with developmental disorders, and then the services they're receiving. What is the long-term consequence from that, right? Getting those services earlier versus later. So that in a nutshell is what this tab looks at. Um, Resilient families and adults. I would say this is kind of like the bread and butter of what human services looks like, and again really captures the scope of those services. So looking at how many, you know, homebound, vulnerable, socially isolated seniors that ADRC is serving. Could look at the number of working families receiving childcare through economic support who are able to work because of those childcare services. It could be the justice involved um, trainees that successfully receive job placement through our workforce development programs. So that's in a nutshell what this dashboard's, or sorry, this tab is capturing. I'll just keep moving along here. Um, we, the county doesn't do these services alone or in isolation. It's because of, and again, Hope alluded to this a lot, volunteers, nonprofits, businesses, you know, county partners, like law enforcement, all allowing us to be successful in the services that human services provides. So some of the things that this dashboard or area captures is kinship providers and foster care homes. Right? So obviously recruiting, licensing, placing kids in a foster care home versus a more institutional setting. What is the impact of that, and how impactful is that for those kids? Meals on Wheels volunteers, just becoming, again, as Hope alluded to, increasingly important. How are we tracking that? Business partners, the Summer Youth Employment Program, which keeps growing and growing, and that just amazing business partnership to give those kids paid hands-on work experience, right? And how impactful that is for their lives. And then I just wanted to share this. You'll see a zero here. Again, we want to build in metrics that we will continue tracking long-term. So this is capturing the continuum of care and those homeless nonprofit partnerships. So that's not currently a metric, but will be in the future. I'll just keep rolling here. Home and community stability. So what services do we provide to keep kids and families in their homes and in the community? So that could look like long-term care support for our seniors. That could look like psychiatric diversions from very expensive institutional placements. It can look like the mental health and substance abuse services that people receive in the community versus going away to more expensive supports. It could look like Rise Up, so the programming within the juvenile detention center and how that reduces recidivism in the long term there. So that's some of the things captured here. And then lastly, this is all only possible because of the staff at Human Services. So understanding the things that matter to staff to help with recruitment and retention is really important. So those metrics are captured here. But yeah, I just wanted to didn't cover everything, but hopefully this is simplified, easy to follow, not only for you all, but for the public to understand what are key impact areas of the department and how are we tracking that impact.
And could you quickly show us how to find it? Because it's live right now, correct?
Yeah, absolutely. So if you go to racinecounty.gov, you could even type in Racine County Human Services Department. This will be the link that comes up, and it'll be right at the top of the page. So when you scroll down, you'll see an Our Values section and then an Our Results section, and that links to the dashboard.
Thank you. Okay.
Thank you, Travis and Michaela, for that work that you have completed over a period of time. And I want to thank Director Otto so much for the presentation of the 2027 budget plan and the goals. Next up on my agenda, we have the public comment period shall not exceed 45 minutes. Each speaker shall be provided a maximum of 3 minutes. The speaker it should register with the committee by providing his or her name and address in writing. The speaker may speak on any item. And I have in front of me the first request from a speaker by the name of Patrick Bohan. Could Patrick approach the podium, please? And I will have my vice chair clock 3 minutes, and we'll keep you posted. Good evening, Patrick.
Good evening, and thank you for this opportunity, and thank you for all the important work that this committee and this board does impacting people throughout our county. It's much appreciated. I am Patrick Bohan. I'm currently serve as president of the board of directors of the National Alliance on Mental Illness of Racine County. Also with me this evening is our executive director, Carrie McGoy. Hope you'll have a chance to meet her. We're very pleased to have her in that role. I just have a couple of quick comments. First of all, I would like to support the comments of Human Services Director Otto, because the whole concept of prevention or early intervention and providing services locally closely aligns with our core mission and values. And it's something we've advocated for now for nearly 50 years. I'd also like to commend the department on instituting the Wellness Connect initiative. It's critical to not only offer services, but to offer them in a way that they're accessible and well coordinated. And this initiative takes us in a significant step forward in that direction. Our county also continues to meet key requirements to deliver services locally to people experiencing a mental health crisis. Our mobile crisis response services, SAIL program that Director Otto mentioned, as well as our crisis line and our crisis line's connection to the 988 crisis line are all critical services. And I encourage the county board to continue investing in those services. We're also appreciative of any initiative that can treat people closer to home. Obviously, we've had concerns for many years with the cost and distance of the Winnebago State Mental Health Institute. So we're excited to see new initiatives and efforts to provide necessary inpatient services closer to home. We also welcome the opportunity to continue partnering with the county as an education advocacy organization. We're working closely with the Public Health Department on a podcast and video series on suicide prevention. And we're always excited to have the county join us for our Go Green Monday education event every year, the first week of October. So we look forward to continuing that and expanding that as we move into this exciting new facility, the Mental Health Center. And we hope to offer additional support groups and educational programming in conjunction with our county partners. Thank you for this opportunity, and thank you for supporting mental health services.
Thank you. I do not have any other, oh, here is one coming up. Thank you. Next speaker I have in front of me requesting is Mike Frontier, 1127 Lake Avenue. Good evening, Mike.
Thank you, Don. Good evening. Thanks again for serving. Just a bit of context from the school board where I spent a lot of time, and especially in terms of our special ed needs and our mental health needs. Tragically, the state of Wisconsin is last in the country in supporting special ed as a percent of cost. We give about 35% of the cost to the school district. Our total budget in the district is about 360 million, 70 million goes to special ed. We have to take about 40 million out of regular education to provide the mandated needs of these special kids. Very difficult budget times, and the state is not helping us or Racine County. And I've been to state budget hearings. This is clearly the #1 issue of the state. To help our schools serves our most fragile kids. And this is the context we're working in here. So we appreciate the initiatives you're making to minimize these lack of services that we we're facing in the school district. Thank you.
Thank you. Are there any other speakers wishing to address the public hearing agenda or any other comments this evening? I'm going to ask again, is there any other individuals wishing to speak this evening in this public hearing agenda? Hearing none, seeing none, asking for an adjournment of the public hearing agenda this evening. Do I have a motion? I have a motion to adjourn and I have a second. The public hearing agenda is now closed. Next up, I will call to order the committee board agenda. Chairman's comments. I am so looking forward to the optimism, to the growth, to the teamwork and the success of the Health and Human Service Division for the balance of 2026 and after that presentation for the calendar year of 2027. I am going to ask if there's any public comments under the committee and board agenda. Is there any individual wishing to make a public comment? Seeing none, I am going to move to item number 4 on my agenda, and I guess I'm going to call Director Otto to come up to the podium because it's open to discussion of the public hearing. Comments that you may have or may not have any comments about the public, about the 2027 budget plan and strategic goals. I'm looking to the committee for comments. Supervisor Shakur.
Thank you, Mr. Chairman. A question I have is in regards to the Jonathan Hillgrave Youth Facility. Are we still in a position that we are getting funding from the state to help out with that situation?
We do not currently receive any direct allocation from the state for operations there. We get youth aids that are to support community-based work. And if you have a leftover of underspent youth aids, you are able to use that to offset expenses, but there's nothing directly given to operate the JDYDCC. And in our conversations with our state representatives, that's what we're sharing with them, that that's a flaw in the design of Act 185, that an operational expense should have been taken into consideration, and that was. But honestly, when you're looking at such a big bill like that, I think it was important to get it passed versus getting in the nuances of the ongoing allocations. But being the first and only in the state, I view it as my responsibility to lift up the concerns. If any other community were to be interested in doing this, this is something that they would want to have as well. And so far, we've received overwhelming support from both sides of the aisle on this, but whether or not anything will happen until the next biennium is probably very unlikely. But that would be taking into consideration for the 27-29 budget.
Just a follow-up. You don't have to answer this right now, but
Okay.
it was my understanding that we would get funding for the facility. No?
Mm-mm.
Can't hear you.
He thought that they gave an operational allocation for the facility, but there isn't. We are able to generate revenue from out of county youth in our facility, and it is, a significant benefit to be able to receive revenue from other counties. But that's, again, one of those unpredictable areas because we can't count on exactly how many youth will be placed with us. So a baseline just allocation is something that I think is a missing piece.
Thank you.
Mhm.
Supervisor Hopkins.
Yeah, I was just curious, in terms of the strategic reserve,
Mhm.
what is it now and what is it projected to be and what's ideal?
So as I mentioned earlier, human services around the state typically do not have a reserve. They often have larger levy amounts comparatively for population, but they typically are not budgeting with a reserve. They use the general fund. We're one of the only ones I know that operate this way, and I think it's a huge advantage. So our reserve balance has varied throughout the years from anywhere between a couple 100,000 upward to 4 million, 4 or 5 million. And so we've been, in the past couple years, fortunate to be seeing those decline in out-of-home placements. We're able to contribute back to the reserves, even when budgeting them, we're putting that back in usually a little more.
Okay, so, well, that, thank for this, because I wasn't aware of that, as far as where it is other places and where it is
Sure.
with us. Any numbers on that now, or?
Yeah, I think, do we have available now, but the amount, or do you have to look it up? About 6
6
million.
6 million? Okay, that's curious to know that. Thank you.
Absolutely.
Supervisor Miller.
Thank you, Mr. Chairman. Director Otto, you gave, one of your slides showed a very significant, I would say impressive, listing of county contracts for the youth care center. Are we projecting, and I know it's totally dependent on what other counties may need and how they would use our services, but are you projecting a number of revenue from other county sources who would use the center?
Yes, that is built into the budget. We built in an estimate of 15 youth, yeah, 15, which we've been averaging around 15.2.
What would that come out in?
Dollar amount 6 million? Does that feel right? Thank you.
Thank you very much.
Comments from the committee? Supervisor Spencer?
Hi, thank you. That's a good presentation. I was shocked, I don't know why, to find out that our ADRC staff is contracted,
Yeah.
that they aren't county employees.
Mhm.
So I think, like I'm in favor of having them become county employees. But my question is really about the 6 facilities that you mentioned earlier.
Mhm.
And if, like, we're paying rent to some of those facilities, are they going to be, uh, is that gonna be eliminated when the behavioral health center opens? Because some of them might move into there. I mean, is that a potential saving as well?
Yes,
Okay.
absolutely, because we will be paying ourselves versus a vendor, for lack of better words, a
Right.
purchase of services. So our current lease at Dominic would be then moved into the 1720 Taylor. Public health, I think the county executive has explored whether or not that's a potential if when Ives Grove, I know has probably some in the future remodeling expenses. I don't know when, but when that happens, this would be an ideal location to be able to co-locate because we're, serving countywide. So at some point that might make sense for them. Burlington, we had the county building, as you know, and now that's a lease space. I believe it's an extended year lease that we're locked in, maybe 10 years. So that, I don't know if that's ever in the consideration of that, but that's another site. The JD YDCC, obviously, Taylor Avenue. So
Or is Taylor Avenue considered 2 sites once that gets going? Or no?
let's say no.
All right, yeah.
I mean,
No,
I
get
think it is one site, but I think from a logistics standpoint for being able to go back and forth for staff, it's still a little bit of a hike. It's a separate building, but it's on the same campus, so less of a barrier.
Okay.
You still have the mic, Supervisor Spencer. It's all right. Okay, you're done. Okay, that's fine. Any other comments? Brenda?
Thank you. I also have a comment about the 25 ADRC positions that you're proposing being made county. I applaud that. I think that's the best thing that you could do. My question though is that you cite that potential savings, net savings about 200,000. Does that include the additional costs that will be incurring for pension and health
It
insurance?
does not. So the legacy benefits are not included in that. It's not a calculation, I believe, that we run. So it's a OPEB. Am I right on that? The OPEB liability that falls under. So that's calculated separate out of our budget.
That is, okay,
Mhm.
okay. And one other question,
Mhm.
with regard to the placement review initiatives, for the adults, is that a requirement for those receiving public funding?
Say that again?
The reviews that we do for placements for elderly or disabled going into.
Oh,
Is that a requirement for those on public assistance?
no, I mean, we do them. Go ahead. Come on up.
Facility wide, we have to do like the PASSR, which does an appropriate screen for nursing home placement or whatever facility they're in. But any facility within the county is required to send that to us to review regardless of who's the funding source.
Oh, okay. Okay. All right, thank you.
Yeah.
Supervisor Meyer.
Thank you, Chairman. Oh, did I see on one of the screens up there that for the JDYCC, there's a service coordinator for after the youth are going to be transitioning out of the facility?
Mhm.
And I think that's really a great idea based on when we took our tour to Mendota. Some of the things that they discussed there as far as you have all this great programming, you have all these programs and facilities to raise these youth up, but then what happens when they come back to the family and come back to some of those household struggles that they had before? And what I found interesting up there is there was such a lack of family contact from those youth because they vary in such age ranges. I think this is great for us to look forward to that, doing this now ahead of time and having the foresight to look at that and make sure that what we're going through with the treatment that they're going through, with the programs that they're learning, and try to bring them back into a normalcy of household, is that they, connect with the family and get them on the right path, similar to what, Supervisor Shakur always says, getting that family involved and bringing them back into that fold is important. And I'm thankful that we have the forefront and the foresight to look at that. So thank you.
Thank you so much for that. And that helps me remember why we think that is such an important position to call out, because I don't want to make it appear as if we're not doing that. We are obviously focusing on community reintegration. It's part of our Rise Up program, but being able to call it specially and have what I call like relentless engagement, having that person solely focus on building that relationship back into the community, the schools, and helping with the peer support and all of the things that are critical for a youth's success afterwards. And having that called out specifically, as well as we are embarking on a new module for therapy, family therapy called FFT. I've talked about this, I think, in the past, but we're focusing on families transitioning back into the community and doing a whole family therapy and support. And this person can help with ensuring kind of follow up and things with that too, like a single focus to be able to make it just that a relentless engagement.
Chairman, one other comment, if I
sir.
could, please. If it's something that on behalf of the board and the committee, if we could get that slide presentation to the county board ahead of time, I think that may help answer some of the questions and then give them some insight of where we're headed with the budget process for next year.
Thank you
Absolutely.
for the comment. I have 3 or 4 comments. Okay, I'm going to start with first. Thank you for your staff, Sarah Kidd,
Mm.
of a year and a half. We're almost there with the contract for the mental health addition in Lake County. That's remarkable, the amount of money that we're going to save and the better services that we can provide. Thank you. Number 2, the JDYCC additions request into the 2027 budget. I personally believe this will help improve our service and improve our liability we may have at that facility. That is definitely necessary. Okay. And third, there's many of the requests that I like. I'm just picking this one out.
Sure.
the need for help with our veterans. I talk to Sean, not all the time, but often, and this is something we're going to see the veterans continue to increase, their ages increase. We need to help assist them. And last but not least, could you, I think I know, but could you tell me and the board and the committee what percentage of the levy that is requested in the 2027 proposal this evening, that of our overall levy, what percentage are we requesting of using for that levy?
Of the total county levy?
Of the total county levy?
I'm going to guess in the ballpark of 16 to 18%.
Yeah, it's a little bit early yet because we don't have.
Understand,
Okay.
16 to 18%. And the total levy in 2026 this year?
I believe it was 10 million with a million in reserves.
Yes.
Okay, but the overall levy, do we remember what the total levy was for the county? Was it like 65 million?
Oh, boy.
66 million.
It was 66 million.
Mhm.
Okay. So this is a time that we are now to take care of the needs of our community, to make sure that we're preventing these issues rather than having them occur. So thank you for your presentation, and I'm looking forward to how we move forward. Are there any other comments from Supervisor Shakur?
Yes, I'd like someone else want to go first.
I see your light on.
Okay, all right.
Thank you.
Well, thank you, Mr. Chairman. I just want to say that congratulations on a job well done. My 30 years being involved in county government, it's been great. Not only the prior directors of human services, but you've taken the baton and you've moved it to the next level. What I want to say is thank you for your presentation. Thank you for always being there to answer the questions. And we really appreciate that so we can serve our constituents and all of wonderful Racine County. And lastly, what I want to say is that I think you're doing an excellent job with the youth and the family.
Thank you.
And nobody, well, he said it a little bit, but you know, that's one of my babies. And
Well, you're
it-
right. You're
just-
100% right.
just keep that going because that'll help us out immensely, well, big. Um, and just closing out, I just want to make sure because I've heard it from quite a few seniors as we be out about the community and district. Just, and I know Travis does a great job and the IT, but we need to make sure that everything we have to offer is user friendly on the website.
Yes. We are actually in the process of a ADA compliance audit and we are working tirelessly. I know Brian Lash from IT and Val Dankolovich from Travis's team have been working on getting a much more accessible website. We're reaching out to our partners at DVR as well as Disability Rights to see if they can provide some guidance for it. But I agree 100%. Accessibility, no matter how it is, through the phone, in person, or our website, it needs to be able to reach all the people in need.
And it makes it easier on the staff and also the elected officials to be able to refer them to a website. So
Yep.
thank you for all that you've done and all that you're doing in the middle and in the long run. Thank you very much for a job well done.
Thank you.
Thank you. Supervisor Spencer.
Thank you. So I was watching and listening this, with a little bit of, concern that there aren't more county board supervisors here that are, extremely concerned about where the funding is going. So I'm want to extend Supervisor Myers' request to have the, PowerPoint sent to them, but I would like to see the video clip of Hope's, the YouTube video clip of Hope's presentation sent to their emails so that it's easily accessible and hopefully it's clicked on. Hopefully it's seen and understood by those who
Great
need to
idea.
know the need. of our Health and Human Services.
Thank you. Your request will be granted. Supervisor Hopkins?
Um, listening to Supervisor Trotter, I think what I heard was, personally, I'm going to trust your discretion in terms of looking at your department and what's needed, what's necessary. Um, but certainly, um, you know, don't pull any punches. Just be clear about what your needs are. And I always put a lot of trust in your integrity in your department.
Thank you.
Seemingly, though, and certainly, as my colleague stated, shared information with other supervisors. Um, because put your best feet forward, put it out there. Because there may not necessarily be the kind of flexibility after the fact, moving forward after the budget's being established to
Mhm.
address certain issues. So certainly feel comfortable, put it out there exactly what your department needs, where it's at. Because you know, the flexibility may not necessarily be there on the back end in terms of so little's needs. Put it out there. I think you have. I'm just encouraged to do that.
Thank you.
And I trust your due diligence in that matter. Put it out there, and I trust that you have. We don't want to be in a situation, and definitely share this with all the other supervisors so they can see as well. Um, because it seems as though you may not obviously have that flexibility once that budget is in place to address things. So I put that confidence in you. I'm telling you to go forth with what you know is best. I'll support that, but I'm encouraging you to do that.
Okay. Thank you.
Thank you, Supervisor Hopkins. Supervisor Miller?
Thank you, Mr. Chairman. I'll continue to thank you for your emphasis department-wide and every member of the Human Services Department, the emphasis on prevention. You know, we've talked about this number, but $2,166 a day at Winnebago. That's almost $800,000 a year. And I know there are other counties that have maybe 4 or 5. So if they have 5 residents at Winnebago, that's almost $4 million spent. And as Mr. Bohan pointed out, it's not as effective as what we do early and locally. So thank you.
Any additional questions, comments by the committee or by the board? Hearing none, I am going to move on. Thank you, Director Otto, for your
Should I just stay here
time
though?
this evening. Yeah, why don't you
Probably.
stand there. I am going to move on to agenda item number 5, which is an action item. Approval of the minutes from June 22nd, 2026 of the meeting of Racine County Health. Sorry, guys. And Human Development Committee and Human Services Board. I need a motion.
I'll make a motion for the committee to approve the minutes.
I need a motion, another motion from the committee. I have a first and a second from the committee.
No, actually have a,
Well, from the committee,
The bo-
and then
He's on the board.
Supervisor Shakur is, oh, he's on the board. That's right. He's on the board. I need another motion from the board.
second. You need a
I
second.
mean, from the committee. Okay, I got 2 on the committee and 1 more on the board. Thank you. I have the approvals for the minutes from the 22nd, 2026. I need a vote from the committee. All in favor?
Peace and governance.
Oh, I'm sorry. Aye.
Aye.
Any opposed? Hearing none. Youth and governance, how do you favor? And the board, how do you favor? Any negatives? Hearing none. The minutes are approved from June 22nd, 2026 by the Racine County Health and Human Services Development Committee and Human Services Board. Next up, I have a report item number 2026 by the county executive, making an appointment to the Commission on Aging and Disability Resource Center Board, action of the committee only. And I'm gonna say to the honorable members of the Racine County Committee here, and this will go to the Racine County Board, a vacancy of the Commission on Aging and Disability Resource Center Board exists. To fill the vacancy, the county executive hereby nominates Leah Nakamura at 333 Lake Avenue, number 403, Racine, Wisconsin. The term will expire March 31st, 2029. Leah is a Racine County resident with a strong commitment to serving older adults and individuals with disabilities and mental challenges. She holds a Bachelor of Arts degree in religious education, an associate degree in sociology, social programs, and certified peer specialist in mental health. She founded a depression and bipolar support alliance support group and facilitated mental health support groups for the past 20 years. Her volunteer work, advocacy efforts, and personal experience as an older adult living with disabilities, she brings an insight and a necessary value to serve on the ADCRC and is committed to helping improve the quality of life for Racine County residents. I need a motion.
I'll second as someone who knows Leah and knows she'll do.
Miss- Thank you. I have a first and a second. Youth and Governance, all in favor? Committee, all in favor? Leah's appointment that the county executive recommended is approved at the committee level. It will now go to the county board. Next up, where is my list here? What did I do with it? Thank you. I have a resolution by the Finance and Human Resource Committee authorizing the creation of 4 FTE sunset positions, including 1 supervisor, parentheses 140, and 3 FTEs economic support specialists, parentheses 125, effective August 24th, 2026, and the transfer of $166,835 within the Human Services 2026 budget. I see. Thank you. We have a motion to approve. Second. And again, this is for information only. So we don't need an approval. Thank you, Supervisor. But I have Hope Otto here to just give a brief synopsis of what this request is.
Thank you, Mr. Chairman. This was a request that was brought forth to the Finance and Human Resources Committee as it is a position addition. And so that's where the primary approval would go through. But wanted to share with you and reiterate the purpose of these positions. They're fully funded by the Department of Health Services with the focus on fraud prevention and client error, as well as potentially errors on behalf of the eligibility worker. The new change, as I mentioned in my public hearing presentation, is that the funding is going to be directed towards an error rate for food share. And right now, our error rate is very low. We experience like one of the lowest error rates in the entire state, like 2 or 3%. But nationwide, it can go into 11, 12, 13%. And so the state, we are measured by a state, not by a county. And so they are giving funds to the counties to be able to support robust quality assurance and making sure that the payments are given correctly. We sunset these positions in the event that anything would change, that we would only be keeping them for as long as needed. And the sole function will be for fraud prevention and detection.
Questions for Director Otto? I have one.
Mhm.
Could you let us, we do this jointly, correct me, with Kenosha County, correct?
We do,
Okay, so it's us in Kenosha County, the numbers are calculated.
yes.
Okay,
And they will be doing the exact same ask. They gave us a consortium allocation and then we divide that up and we add
Okay.
our staff and they add theirs.
and curious, where's their numbers at? I know ours are
They're
very low.
combined.
They're
Yeah,
very low like
yeah.
ours.
We're measured as a consortium. We're not
Right,
viewed
well,
as a
it's, that's right,
county.
it's
Yeah,
together,
yeah.
yep, okay,
But
thank
we
you.
still operate operations somewhat independently.
Sure. Questions from the committee, or this was information only? Seeing none, thank you very much, Director Otto. I'm going to move on to review of the Human Services 2027 Budget Plan and Strategic Goals. Are there any additional questions, comments for Director Otto in regards to the budget plan and strategic goals? Thank you. Gang diversion grant and gang prevention grant. Steve Bedwell. Good evening, Steve.
Good evening. Thank you. Before you, requesting acceptance of two grants. These are Department of Justice grants. One is a gang prevention grant in the amount of just over $96,000. This would be our second year receiving this grant. And the gang diversion grant for $62,000. This would be our first time receiving this grant. This was a single grant that the Department of Justice had issued out there across the state. It was just for one award, and apparently they like what we're doing. So these two grants help fund our Path Forward Youth Jobs Initiative program, provide 6 months of paid employment, $12 an hour for youth at 20 hours a week. These two grants will help fund the next year of us continuing this program. We have 1 year now under our belt of administering this Path Forward Youth Jobs Initiative. For our first year, we've had 29 youth participate. We have 17 youth actively participating in the program right now. We've had 8 youth successfully complete their 6 months of paid employment. I know one has received a full-time job somewhere. Another youth is working 40 hours because the business has matched our 20 hours for them this summer and is paying them an additional 20. And we have one kid who just successfully completed and was recently hired on by his place of employment. So we are seeing great success with the kids that are involved in this Path Forward program. So these two grants will help fund us for another year. So please accept.
And Steve, how long has this program been?
1 year. we've
place?
been doing this.
This is 1 year.
Yep.
Okay. And this is information only. So are there any additional questions for Steve Bedwell? No. Thank you, Steve,
Thank
very
you.
much. Information only annual overdose awareness event, Yelena Jones. Now I have
Yeah, you have me again.
again.
So I believe this is in your handouts as well, but this is our annual overdose awareness event. They're usually pretty well attended, and it's a really meaningful event just to bring awareness to those who have lost loved ones to any drug overdose. And I wanted to also talk briefly, in addition to this event, and we can share this out electronically as well to the county board and to the broader listserv. But we also had an ask from the board and committee to have a presentation by Dr. Galbus, who is our addictionologist in our clinic and has done a lot of work with harm reduction and our substance abuse treatment. And he is going to be presenting at the August meeting. And additionally, we are looking to do a mental health symposium October 7th, and it's joint planning of public health and behavioral health. Public health received a grant that was for building education and awareness in the community regarding opioid addiction, mental health, and a variety of issues. And we're going to have a host of local clinicians and providers, as well as law enforcement, and just talk about just the broader community landscape supporting behavioral health and substance abuse. So stay tuned for that. Just wanted to put all 3 of those on your radar.
Thank you. Any correspondence in other business? Our Supervisor Miller.
Thank you, Mr. Chairman. Over the past year, Meals on Wheels has been a topic of this board and this committee. And on your desk, you should see a reprint of an article very recently from Time Magazine about the national program. It's interesting. I encourage you to take a look at it, but 1 in 3 programs nationwide has a waiting list of on average of 4 months, and some programs have 4,000 people on a waiting list. So through staff initiatives and the generosity of groups and individuals in the county, we do not have a waiting list, but I thought it would be of interest to both the board and the committee.
Thank you, Supervisor. Any other correspondence and other business we'd like to address this evening? Okay, the next meeting scheduled for this committee and board is August 10th, 2026 at the Ives Grove Office Complex Auditorium. I need a motion to adjourn.
For the committee, I will so move.
Board. And the board is adjourned.
No, you need a second.
I need a second from each. I have a second and a second. We are adjourned. Thank you so much.